Following the recent National Pain Survey in Australia, I've been asked, why do I think 26% of Australians experienced enforced opioid tapering recently? Or, in other words, they've been removed from their opioid therapy, often against their will. I would have thought best practice would have been a mutual agreement between patient and doctor. Be that as it may, I think the main reason so many Australians have experienced this situation is because of Australia following the US experience, where they have regularly 100 to 110,000 per year overdoses on opioids. But they forget to mention that 80 or 90% of this tragic situation is due to fentanyl, a system, or I should say, a situation we don't have in Australia as yet. Perhaps one of the reasons this has occurred is fear of addiction, fear of prescribing opioids, making sure we give opioids to the right people, but in the end, we've actually harmed those that we're trying to treat. This could be a lack of training. There is no one size fits all, but this seems to be the current practice. Patient care should be, in my opinion, patient-centered, and patients need to know the reasons why they're being tapered. In many cases, this hasn't occurred. It's not actually in the legislation yet. Clinical need takes priority. The Therapeutic Goods Administration opioid prescribing guidelines were changed on the 1st of June 2020, but it still says, and I quote, the regulatory changes will not lead to a ban on prescribing opioids to any category of patient if ongoing use is considered clinically appropriate. It's more about having them have this discussion, not ban opioids, deprescribe opioids across the board. Chronic non-cancer pain deserves to be treated, especially people who have persistent pain 24/7, disabling pain, high impact pain. There's also a blurring of the lines, in my opinion, between addiction and physical dependence. They are not the same, but they seem to be intertwined in much policy and statements lately. Maybe we need better clinical tools to assess opioid hyperalgesia versus tolerance and withdrawal issues. There need to be clear communication between the specialist or the doctor and the patient. Not everyone experiences improvements after being tapered from opioids. Many have extreme effects. So in summary, I think we need to look at patient-centered care. Don't deprescribe patients unwillingly, and look towards a holistic plan where pharmacotreatment is just part of the equation. Thank you.